Cuando tu tipo así por la dipela que apilo.
De dónde está pile galera.
Da de da música que com ali de.
बीबीआर खाए होगी? अरे हाँ खाए तो है तभी तो कम नहीं हुआ। कितने देर खाए थे? कितना बजे? 2 सुबह में सर्वर भी हो रहा है।
नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभं करिष्यामि प्रसन्नां भव सर्वदा. Namaste friends, and sorry for the delay. Let us start with a case. A 34-year-old man of, say, highly muscular build who was a smoker come to the clinic. Just surgical history, appendectomy many years ago. Constant and significant neck pain with severe headache and intermittent blackouts. Weakness in legs. Recently experienced 2 blackouts from which it took him several minutes to recover. Symptoms caused major depression also, because previously he was very fit and able to lead normal, active, very active life. He was having cervical whiplash injury, but it was minimum due to low speed impact. That's it. But there was no much problem. Sneezing causes significant increase in neck pain. If he lifts minor weights also, he may get pain in the neck region. Neck pain increases severely with all movements of neck, and neck movements were severely restricted because of his neck pain. If he takes NSAID or muscle relaxants or even say Snehalswedan, there was no much relief, or it was only temporary limited relief. So he was put on antidepressants also by various physicians and orthopedic surgeon also. And there was no significant cervical spine, though there was significant changes and one can see cervical spine syndrome, still it was related to the depression also. Physiotherapy, no benefits. He consulted many specialists also, and one neurologist, he examined him very carefully. That is what patient told me. Pulse was regular and everything was fine. But say, even with the X-ray, it is very significant. The neurologist came to know about this particular X-ray. Posterior arc of atlas is missing apart from posterior tubercle. See, you can see that white arrow. It shows posterior arc of atlas is missing apart from posterior tubercle, and that is assimilated into occiput, very limited range of cervical spine extension and flexion, as well as limited skull cervical spine movements. Now, this posterior arc of atlas is missing apart from posterior tubercle, which is assimilated into the occiput. That is the finding, and this finding was told by a neurologist. 3 years ago, while driving during work, the rear-ended vehicle in front at approximately say around 60 kilometers per hour, it dashed his vehicle. At the time of impact, his head was turned to one side, and within 15 minutes, he experienced burning pain posteriorly in the neck. 3 days later, pain became so bad that he required strong painkillers for that impact. At the time of impact, his head was turned to one side. Within 15 minutes, he experienced burning pain posteriorly in the neck, and 3 days later, pain became so bad that he had to take many strong painkillers for that. So that is a peculiar history given by the patient. The neck movements were severely restricted due to significant increase in pain, and neurological examination was normal. Abduction of arms beyond 90 degrees aggravated his neck pain. So these are his main things. See, there is some encroachment of C3, C4 intervertebral foramen, and due to osteophytic encroachment from the unconvertible joint. Now, in cervical spine open mouth X-ray also, and in case of plain lateral X-ray also, patient was found arc of atlas is missing from posterior tubercle. Otherwise, X-ray examination was normal, and just only one thing, there was assimilation of atlas within skull base. Because of severity of neck pain with restriction of all active movements, he didn't try MRI at that particular time. Afterwards, he did it. This was cervical spine soft tissue injury, includes vascular component which was causing blackouts. There was a question mark, vertebral artery injury. If it is related to vertebral artery injury, symptoms along with neck pain and restriction of movements, there is a particular symptom known as blackout. Many a times patients get blackout temporarily for a minute or two, maximum for a minute or two, and afterwards they get relieved. from that pain. So the diagnosis is cervical spine soft tissue injury, includes vascular component because of which pain, restriction of movement, and blackout was there. So this is one of the important point to be noted in this particular case. In this case, first of patient was treated with for 3 weeks with Samir Pannag and Trayodashanga Gogul. After 3 weeks, he was treated with Uttar Bhaktik Sneha. And for that matter, patient was given Uttar Bhaktik Sneha Jivantyadi Guruta, mainly for vascular component along with soft tissue injury. Patient was treated with Jivantyadi Guruta. Uttar Bhaktik Sneha Jivantyadi Guruta was his main treatment. Along with that, local acting, say Manya Basti and Pichu with the karma was done. Patient got relieved within a span of say 8 to 10 weeks. That is 2.5 months. And that's it. That is the first case. One more case. In this case, this is a 29-year-old woman, and slightly she was overweight, and there was no such past history of this patient. Only thing, operation of her left eardrum was done around say 8 to 10 years ago. She was having chronic neck and upper thoracic spine pain. Her main complaint was neck pain, which radiates to both arms variably, sometimes has burning sensation. She was also experiencing intermittent pain radiating around her rib cage at breast level. Physiotherapy treatment was done to her neck, and upper thoracic spine feel worse. So she stopped all the treatments, mainly local acting treatments. Physiotherapy was increasing her numbness in the hands. Traction was increasing her numbness in the hands. That is was she told to the nurse. And she tried many medications, many self-medications, many YouTube treatments she did. And one of the neurologists advised her to go back to work also. But it was increasing neck, arm pain. She was referred to psychiatrist, psychologist also, and she was say depressed after going to them. That is say agony in this particular case. There were many trial and error in this particular case. When she was undergoing of say electrical nerve stimulation, that is TENS, chronic neck and arm were paining, and she could not wear say her clothes also as the actions were aggravating her neck pain. Squashy sensation was there at times while moving the neck. She was awakened by pain during nights and in particular time. After Sweden or after hot water fomentation, that gives her temporary relief, and her what we call it as she was not understanding why water feels hot on arms and hands. Hands also, but not when it is directed onto her cervicothoracic region at hand and at forearm. She was feeling that hotness or that hot feeling was there, but at cervicothoracic region she was not feeling any hot thing, and there was a Sweden at that particular area. The motor vehicle accident was around say 2 years ago, and it was like say jerk backward and forward like whiplash injury only, and uh, it was very much painful, severe neck pain for few minutes after accident, and she was after that she was taken to the hospital immediately, etc., etc. The reflexes were normal as such, but restricted movements were there. Eye movements were normal, and other things, blood pressure and everything was absolutely normal in this case. SLR and everything was also normal. See, this was whiplash type syndrome due to soft tissue injury, particularly at C1, C2 and C4, C5, C5, C6 level. So all the reports were done, X-ray reports were done, and examination was also normal. That way, it was very much normal. So it was soft tissue injury only. And these type of patients come to you. Flexion and extension, functional views should always be taken to determine whether there is any cervical spine instability, unless there is contraindication, such as, say, suspected vertebral artery injury with dizziness and nausea, or say joint dislocation. That is to be ruled out, and then we have to do full flexion and extension of that particular joint. See, patients receiving needle acupuncture for cervical spine injuries should preferably be treated in seated position. When you are doing Agni Karma and Vidya Karma, do it in seated position to eliminate hyperextension of cervical spine, unless patient is comfortable lying on their side. When we are doing Agni or Vidya Karma in these type of cases, remember that patient should not fall on the chair because of any shock or something like that. So remember all these points and then go ahead with the case. This is a third case. All these two were, say, soft tissue injuries. This is intervertebral disc protrusion case. This is 46-year-old married man, and he was having a motor vehicle accident 10-12 years back, and there was tingling in middle finger. Middle finger is related to C7. Symptom came on immediately following motor vehicle accident, and for 3 years he saw several doctors who gave him that pain was, say, psychosomatic. Eventually he was referred to a psychiatrist. And the psychiatrist told him the best advice he had ever been given during the psychiatric evaluation. The psychiatrist told the patient that he knew exactly what was wrong. So patient asked him, how did you know that? The psychiatrist had that type of motor vehicle accident and ruptured a disc in lower part of his neck, and he was told that he was imagining his problem and going to many surgeons for opinion. One orthopedic surgeon did MRI and found that disc prolapse was in his neck. Then he was relieved with proper treatment. That psychiatrist was relieved with proper treatment. So because of which the psychiatrist told the patient that you must be having intervertebral disc protrusion at cervical spine level, because of which you are getting radicular symptoms and tingling in middle finger. It must be between C6 and C7. So it was not a psychiatric case, it was a case of intervertebral disc protrusion. Right and left sided neck pain was there. uh, the proper diagnosis was done of this patient, and the diagnosis was IVPD and intervertebral disc prolapse in case of mainly cervical spine is very difficult to treat, and the probability of getting cured is just 50-50%. So that is very important. Although all these things, forget about all these things. But if a patient is diagnosed correctly, then you can do the correct treatment also. In this particular case, we avoided Nasya. We did Manya Pichu of say Vishagarbha for say 5 to 7 days, and then Bruhat Sindhavadi Tel for next 7 days. After that, next 7 days, Bala Pichu was given, Bala Tel Pichu was given, and along with that, patient was treated with Panchatikta Vrata Gugul and some other Balya medicines. With that, he was given soft collar for cervical spine for a few weeks. Along with that, he was given physiotherapy also after 15 to 20 days after the muscles got relaxed. Patient got really well in this case. His numbness was totally gone, and patient was all right. But the main important point was the diagnosis, correct diagnosis, because this patient had been referred to a psychiatrist by an orthopedic surgeon. Only because psychiatrist was knowing the exact problem, because he has undergone that problem. So he could be able to trace the patient's problem. Bearing in mind the issue of dermatomal pain patterns discussed in introduction, it should be possible to make a clinical diagnosis of central or posterior-central cervical disc protrusion. In this case, MRI is useful tool for, say, suspected cervical spine disc protrusion. MRI can be used for confirmation of disc bulge and protrusion, but may miss tears in annular fibers. So MR is confirmatory for disc bulge, for protrusion, and for annular fibers. You must see into details for MRI. This is again a fantastic case. This is joint osteoarthrosis. This is, say, 50 years old woman. She was having left C2 at that particular area. There was a surgery done around, say, 20 years back to this patient for, say, left-sided headache. Neurologist performed that surgery around 20 years back, and that's it. But there was left-sided headache was still there. Appendicectomy, cholecystectomy was done for, say, a few years back. Chronic left-sided neck pain and headache that had flared up during last few months, having begun, say, around 2 years back. She has history of headache. since 20 years. She did multiple investigations, multiple treatments over the years. The present headache and left-sided neck pain was something different. These headaches appear to be severe vascular. Uh, this particular headache was related to, say, tension type due to severe cervicogenic pain. Left-sided neck symptoms of feeling hot, followed by pain radiating from, say, C5 vertebra to upper neck behind left eye, causing severe headache. See how patient is describing his pain. Patient tells you she was feeling hot, then followed by pain radiating from left side at around, say, C5 to upper neck, then behind left eye, causing severe headache. These neck symptoms are precipitated by various neck movements, which causes hot sensation on left side at around C5 spinal level. She was given many types of, say, painkillers, anti-inflammatory medicine, even antidepressants also for a chronic neck pain syndrome. But there was no help by all the medicines. Then she was given Depo-Medrol injection also, local anesthetic injections, many things. But even spinal manipulation did not help her. And on examination, say everything was normal, but power in upper and lower extremities were normal, but at C4, C5, diminished power on flexion C5, C6 and extension C7 at elbows. There was diminished power loss. Cervical spine ranges movement were limited by neck pain. During extension, it was absolutely limited. That's it. What is the clinical diagnosis in this case? See, you can see one black arrow and, say, second one is white arrow in this picture. See, you can see the clip, that is black arrow, in left suboccipital region, where her C2 related surgery was performed and C2 nerve was clipped and divided. At the level of C5, that is white arrow, fifth vertebra, that shows osteophyte projecting from the left joint toward vertebral artery in transverse foramen. See, this particular osteophyte at C5 level, that was compressing her vertebral artery, and because of which patient was getting impingement, patient was getting pain because of that. This case shows you, say, neurological plus vertebral artery related symptoms, vertebral artery may be irritated by joint osteoarthrosis. That is what told in this case. Again, in this case, we used Panchadikta Vrata Gugul as a drug of choice along with Bruhat Saindavali oil for Pichu. That was the only two main treatments done for this particular case. But patient was convinced because he was described everything in detail, and then only we started the treatment. Cervical cord myelopathy is also one of the main point, one of the main case we have seen. This particular case also, this is also a peculiar case. This is related to vertebral artery only. Why I am telling you in cervical spine, why I am talking about say a vertebral artery, mainly because of vertigo. See, this is 41 years old man. When a patient presents with unexplained headache with neurological involvement, you may consider intracranial or and extracranial cause. Remember this. There must be some intra or extracranial cause. That is what is very important. He suffered from cluster headache for say around 8 to 10 years. Suboccipital neck pain was his history, and it was radiating bilaterally to cause frontal headache, which occur mainly on Saturday, Sunday, and he was having a complete the whole day, he was having headache. This was associated with nausea and dizziness. He was not suffering from photophobia. He was not suffering from Shabda Sahishnuta. He was not suffering from any eye problem. Neck pain is worse when he is tired. All neck movements were increasing his neck pain. Otherwise, his health was very good. And he did physiotherapy plus painkillers for many days, but it was in vain. Some painkillers gave him good result, like aceclofenac. In neurological examination, there was no defect as such. Deep palpation of say upper cervical spine, paravertebral muscles elicited bilateral tenderness. But his blood pressure was absolutely normal. In this case, this shows at say C2 foramen transversarium, and you can see two small arrows that indicates smooth curvy linear line that caused by vertebral artery tortuosity. Tortuous. Vertebral artery gets tortuous, and it gives result to cluster type of headache. This case was explained to us by an orthopedic surgeon. This is a peculiar case, and this case was treated temporarily. You have to give this patient muscle relaxants. We educated this patient, a vertebral artery, um, tortuosity. It gets tortuous. In this particular case, you have to apply any liniment. Along with that, we gave him Samir Pannag plus Mahavat Vidvans and Panchatikta Dhutagugul. Patient relieved in these particular cases. So this was again a different case. Now let us come to some clinical tests. We will take only 4-5 clinical tests today, which are important, and tomorrow also we will be talking about some clinical tests related to it. Okay. In cervical spine, we should understand vertebral artery related pathology, neurological pathology, or osteophyte related pathology, that is bony pathology. We should understand the pathology related to, say, strain in that particular area, strain or sprain in that particular area. The pathology may vary from muscle, from ligament, from bone to vertebral artery also. Patient is instructed to swallow in this particular case. A positive test is one in which patient experiences difficulty or pain on swallowing, which indicates cervical spine pathology, mainly bony protuberance, bony osteophyte, or soft tissue swelling, maybe due to, say, hematoma, infection, maybe tumor also in anterior portion of cervical spine. So this is very important. This is also one of the important test, that is temperature test. See, examiner or a doctor alternatively applying hot and cold test tubes just behind patient's ears on each side. If patient causes vertigo, it indicates inner ear infection. In cervical spine pathology, please rule out cluster headaches and vertigo, and then you have to treat it with the perfection. See, this is known as vertebral artery test. You have to open your eyes and lie down in supine position. Now, doctor supports patient's shoulder with one hand, and with other hand, passively he is extending patient's head and he is rotating it to opposite side. Doctor maintains this position for, say, 15 to 20 seconds, and he will observe patient's eye movements. If he is getting asymmetric pupil change, then what? Patient may report any unusual sensation like, say, dizziness, giddiness, lightheadedness, visual changes, etc. Then this test is to be performed on other side also. If patient is having nystagmus of eyes, asymmetric pupils, or experiences unusual changes, it is vertebro-basilar insufficiency. If you are turning your head completely with the support of other hand, and if patient is getting nystagmus, if patient is getting slightly blackout or vertigo type of symptoms, then the pathology is related to vertebro-basilar insufficiency. Now, patient is in supine position. Doctor passively rotating patient's head as far as possible, first to right and then to left. Then patient is instructed to rotate the shoulder as far to right as possible and as far to left as possible, while keeping eyes open and looking straight ahead. If it is positive, dizziness test is positive, it causes dizziness while head and shoulders are rotated. This is known as, if you experience dizziness, then it is vertebral artery dysfunction. If dizziness is experienced only when head is rotated, remember this thing, it is very important. If dizziness is experienced only when head is rotated, then semicircular canals of inner ears are involved. Remember this thing. Eyes should be open. You can rotate, and you should lie down, and the doctor or your mother will rotate your neck. And if you are experiencing dizziness, then while say when head is rotated, then it is semicircular canal of inner ear are involved. That is what is you understand. Very, very important. We say there is no vertigo in cervical spine, but no, my dear friends, it is very much important. You can see this. Examiner places one hand over patient's forehead and thumb of other hand over spinous process of axis. Patient instructed to slowly flex the head, while examiner presses backward with hand placed over patient's forehead. Now he is giving counter pressure. His right hand is on a patient's forehead. You can just press it behind, and at the same time, left thumb should be pressed in between that occiput, that particular spinous process of axis. Positive test is one in which patient's head slides backward during movement, and he may get a cluck sound, which indicates subluxation of atlas and axis. It is in case of whiplash injury. Remember this while asking for genuine history. Now remember one thing, this test is to be performed with extreme precautions. Now say one more test. Examiner stand at the head of patient and rest on patient's head on examiner's abdomen. Say examiner or a doctor cradles patient's head with both hands and places fingers on upper cervical spine on each side of midline. Now the examiner will slowly side bends patient's cervical spine just a few degrees. Just he's tilting his neck. Spinous processes do not move as patient's cervical spine is being side bent. It indicates odontoid fracture or ligament rupture. This test is to be done with extreme precautions. That is what is very important. There are other tests also. Tomorrow we are going to see other tests also related to cervical spine examination. There are 7 or 8 different tests. You can see that. So thank you all for today. Today we have seen some cases, 3-4 different cases. Every time cervical spine, then bahu shirshagate vate nasyampanam cha uttar bhaktikam, then yoga bastikram, agnividya karma. No, important is diagnosis. Whether the pathology is related to say bone, vertebral bone, or ligaments related to it, or intervertebral disc, osteoarthritis, or myelopathy. Tomorrow I will be talking about 2 different cases related to myelopathy. So there are n number of things which has to be evaluated properly, and then you can give him proper pinpoint treatment. Important is diagnosis. So thank you all for giving me this opportunity. Thank you Shreyas E-Learning Academy for giving this type of activity. Thank you all, and for giving us good feedbacks. We are very happy to take all these feedbacks positively, and there are so many positive feedbacks for which we are very much thankful to you. Thank you Shreyas E-Learning Academy, and thank you all for listening patiently. Dr. Sankalpa?
Yes, sir.
Today's lecture is over. I think it will take 2 more lectures.
Okay, sir.
Thank you. Today's lecture is over.